Good morning. Good morning. It's so good to be in a nice warm place, my office, and I'm sure that everyone that is on is in a safe, warm place with this terrible snowstorm. But when you look outside, it is pretty. So just stay inside and stay warm. Before I start my presentation, medication management, I just wanted to remind everybody that I think this is important to realize. We're talking about medication management. And I think everyone on the call and all of us as we age should keep a list of your current medications in your purse or in your wallet because it's very important. And keep that list and it updated, even if you take a pill just once a month. Everything should be on that list and keep it updated. And I only say that because let's say you're out shopping in a grocery store and you trip and you don't get hurt, but you did go down. And the manager of the grocery store comes up and says, well, we don't want to take any chances. They call an ambulance. You are sent to the emergency room. You try to reach your daughter and tell her what happened. You are just so stressed out. You finally get to the emergency room. They put you on a stretcher and they're asking you all your questions. And then one of the very first questions they're going to ask you, what medications are you on currently? Well, if it was me and I was anxious and I was scared and I didn't know what was going to happen, do you think I could remember even one medication that you're on? But you just go into your purse or wallet and hand the person that medication list. So that's just a tip. And I wanted to say that before I start, and I'm going to repeat it at the end because I think it's so important. Anyway, my name is Geraldine Kohút. I am the community liaison at Cathedral Village, and I so enjoy working with everyone. And Maria has been so wonderful in providing such good support for our programs. Why is medication management so important? First of all, it is so important to understand your current medication for a successful recovery or continued management of a chronic disease. Seniors take more medication on average than people under the age of 65. Essential to take the right medication at the right time and be alert to all side effects, which we will certainly talk about later on. Management is your responsibility. So you go to the doctors and they give you medication and you go to the pharmacy and you get it filled, but it is your responsibility because you are the person taking that drug to report anything that is untoward. So you should be alert to any adverse drug reactions. There's an average of over 200,000 drug reactions annually. These drug reactions are generally seen in the emergency unit because you don't know what's happening. You don't know why it's happening. All you know, you broke out in hives and short of breath. You call that ambulance and now you're in the emergency room. And that is, that's a place to be, but they will ask you again about your medications that you take. You are more than 7 times more likely to be hospitalized after an adverse drug reaction. So this is so important. And as I say, it's your responsibility because you want to be alert to what medication you're taking, why you're taking it, why your doctor has ordered it, and the pharmacy that filled your prescription. I always say, ask your physician. This is a dialogue that you should have with your doctor or nurse practitioner. Every time you go to their office, review your current medications. Ask the doctor, should I still be taking this medication prescription? I've been on it for like 2 years. I'm really not sure why I'm still on it. Are there any medication prescriptions currently prescribed? Then I can eliminate it. I already take 5 pills daily. And is there anything that is a sort of something that I'm a little bit better now and I can eliminate it? Fight for your right to do this. Review need for over-the-counter medication. And that should also be on your list of all over-the-counter medications that you take and why you take it. Because when people think over-the-counter, well, that's not really that significant. I mean, I can just get it at a drugstore, but it is significant because some of these over-the-counter, really, there are some medications that are over-the-counter that also require a prescription. So you really don't know the differences, and don't take over-the-counter drugs lightly. A new medication order. Understand all new medications that have been ordered by your physician at time of order. Make sure your ordering physician is aware of all current medications. And I say that because we do change physicians. We also do go to specialists. So they may be ordering something for a pain that you have in your shoulder, and you weren't sure if there was a problem with it or if there was a nerve touching the muscle in that shoulder. So you go to the doctor. And, that's what that doctor is focusing on, pain in that shoulder. So you have to really alert the doctor, why am I taking this medication and why are you ordering it for me? This is a big one. Use consistent pharmacy. The same pharmacy knows your medication profile. That is so significant. A lot of people will have their main pharmacy. It may not be as close to their house, but they know they go there, they're reliable, and also they have a lot of other things in the store, so that's your preference. But there is another pharmacy that is sort of a little bit closer, and you just want to run in because the doctor just ordered it for you, and you know that that's all they do, and they even deliver. But you should use the same pharmacy, so there are no situations that you might be taking a medication that might be sort of not good for you with a combination of a medication. Reading medication labels. Well, it is important to read them. You open your little box of pills, a new prescription, and then you open this sheet of paper. You open it very widely, and it's like 3 different pages. The print, you need your magnifying glass, but it is important to read those medication labels because they will tell you everything that you need to know. And take your time when you're reading them, especially when it is a medication that was just ordered and it is a new medication. So they're going to give you pharmacy information, patient information. In other words, what you need to know in taking this medication. The prescribing doctors, drug name and strength, all of the instructions about taking that specific medication is so important. The prescription information, pharmaceutical information, federal caution statement, all of this is in that little fine print, but you need to look at what's so important to you, and that's how you take the pill. And then they go into drug facts. What are the active ingredients? Why does a doctor or a nurse practitioner order this medication? That means, what is the use for this drug? What are there any warning signs? And you really want to look at that because you may be taking medication, all of a sudden you start getting some abdominal pain and you're not sure, is that abdominal pain, is it connected to this medication? But they will tell you what the warning signs to be alert to. You ask a doctor or a pharmacist before use if you are taking a sedative. When using this product, it's all of the do's and don'ts you would ever need to know when you're taking this new drug, and they will list them, the do's and the don'ts. If pregnant or breastfeeding, ask healthcare professional and understand the directions. Some directions are very basic, simple, take in the morning with a full 8-ounce glass of water, but some are more complex, so understand those directions. The directions, and again, are going to do warnings, inactive ingredients, purpose, and other information. And it seems like a lot, but you're not getting this new prescription every day. So it is important to read it. And another tip is to save that sheet of paper, because you never know. You may take that medication, you're really doing wonderful on it. All of a sudden, like 3 weeks later, you have a little bit of a concern about why you feel this way. You go back to that list just to make sure it's not the medication that might be causing your symptom. Common medication mistakes. Polypharmacy, I already told you that. Stick to one pharmacy. And I'll use CVS as an example because that is the pharmacy of our choice. And when we go, they just pull up your profile and they can tell you right away, number one, is this medicine that you are just having ordered, is that consistent with the medications that you're taking and the diagnosis that the doctor placed on the medication order? Also, you might have some cognitive decline. So you might not understand the exact reason why the doctor has ordered that medication. You can have a medication error, and that means you missed a dose, it's the wrong dose. So you call your healthcare professional. Better safe than sorry. Some people say, well, I can miss it. I just missed it one time. Well, maybe you did just miss one dose, but it's important because there might be an issue happening that you're not even aware of. It's better to be safe than sorry. Storage of medication. Well, not in your bathroom. The bathroom is not a good place to store your medication because there is humidity and temperature in the bathroom, and that can cause some of the medications to deteriorate. So if you do store your medications in your bathroom, I suggest moving it in another area of your home. A safe area will be kitchen or bedroom, but just remember, so many people do think of keeping it in their bathroom. Number one, if they take something at night, it's right there. The sink is right there for your water, but it is not, it's not the best place to store your medication. Unwanted or expired medications. Well, I'm going to list this because unwanted or expired medications means that they're out there. They're still in your medicine cabinet. They're still in your kitchen if you keep them there. And you no longer need it. That's what unwanted is. Or the medication is already expired. As a result, 2,500 children abuse drugs for their first time daily in the United States. 2,500 children. 70% of opioids prescribed remain unused, available for abuse. 200 Americans die every day from drug overdose, and 2 billion opioid prescriptions dispensed from 2012 to 2018. And I'm going to go back to the 70% of opioids prescribed remain unused, available for abuse. Oftentimes, physicians, if you go to the doctor and let's say a surgeon, and you go to that surgeon and you've had a knee issue and he had to drain the knee from water and it is very painful. It's not broken, nothing's happening, but you had water in the knee, so therefore he drained it. And it was very painful during the procedure. And he said, stay off of your knees, certainly keep your leg elevated on a pillow. And I'm going to give you some painkillers because you're really going to need it. It's going to hurt. You know that right now it's really hurting and it should ease up in about 2 weeks, but I'm going to give you pain medication. Oftentimes, they give you more than you need. So you might be given an opioid prescription for, let's say, 30 pills. That's kind of average. It used to be kind of average. And after, I would say, they're recommending to take it as you have pain, you might feel pretty good after like 5 days. But guess what? You still have about 25 pills in your bottle. And that is a way that people can really, you forget about it, or you have another kind of a pain and you still have 25 pills left, you start taking it. So abuse of opioids sometimes is the result of physicians overcommitting to the amount of pain that you have. So that's something you have to really be alert to. Now, I know there are really rigid rules about opioid prescriptions, and now most of them count them. So most pharmacies will only accept a 3-day supply for an opioid prescription. And that is because what has happened with the opioid unused, and they are still available and people pass them around. Somebody says, well, I have such a terrible pain. And all of a sudden you say, well, I have some pain medication. You're not talking about an opioid. You don't even know what an opioid is. I have some pain medication. It worked great for me. If you want them, I can give them to you. This is what happens with unwanted or expired medications. They're out there. Where to find expiration dates? That's really a good thing to think about. Prescription medication, date on the bottle or container. So if you get a prescription medication, pharmacy gives it to you, that date is absolutely going to be on the bottle or on the container. Over-the-counter medication is printed on the label or stamped on the bottom of the bottle. When they're on the bottom of the bottle, they're really hard to read. Sometimes you have to get a flashlight, but that's where it would be over when it's an over-counter medication. And ointments, that's going to be on the crimp of the tube. So it's good to look at these to find out if your medications are expired or not. Daily medication schedule. List all prescribed current medicines on a sheet of paper or computer and print the list. I already said this, keep in purse or wallet. The schedule should include the medication name, time to take the medication, your dose, and check day of the week, Sunday through Saturday, or whatever day you're taking it. And there are some medications, especially like for osteoporosis, they're having you take it once a month. So just keep this list and be accurate on it. Delete, as I said, if the medication is removed, and add all current medications. Now, there are so many devices out there that you can put your medications in as reminders. Medication device protect sensors. They are pill organizers, pill dispensers, alarm style reminders, or timer medicine caps. So we're going to review them because, as I said, it's very interesting to know that these things exist. And I'm sure you've used them, and I'm sure you have them. They're easy, they're convenient, and it does allow a person that just, wants to say, okay, I have to take my pill in the morning. You just go to your organizer. There it is. It's listed for Thursday. You take the pill, close it, it's empty. Next day is Friday, and you're going to open that organizer for your morning pill. So a pill organizer come in many shapes and sizes. Most are highly portable and can be slipped in purse or pocket if using outside your home. They are large enough to accommodate generally an AM and PM use. Now, some of them are just one slot, but they are generally accommodate both AM and PM. The average cost of a pill organizer is about $10. They're plastic, they're convenient, and they really do help to organize the medications that you are taking during the day. Another one, which is good, it's called an automatic pill dispenser, portable device that allows you to organize your medication by day and time. There is safety locking system on these dispensers. They dispense the correct pill and correct time via an alarm or reminder. Most also lock when not in use. So what's going to happen, there is going to be a correct pill and correct time, an alarm will come up. So if you like this kind of a reminder, especially if you are having to take maybe pills 4 times a day, it really works because you're going to hear that reminder and you'll know that it's time to take your medication. And it might sound like, oh, I would never use one of those. It works and it does help, especially if you have multiple medications that you're taking. There are alarm style reminders. Generally, they have 4 alarm settings. So that would mean your morning, your lunch, dinner, and bedtime. So there are people that have to take medications 4 times a day. An alarm will go off each time you are required to take your medication. Some have alarms that speak, that when the alarm time goes off, good morning, it's 9 a.m. and time to take your morning pill. Well, it sounds like somebody is living in your house, but anything that helps to make sure that you are taking the correct medicine at the correct time. Another one is a timer medicine cap. Timer medicine caps are digital timers with a count up feature that works like a stopwatch, automatically keeping track of how much time has passed since the last medication was taken. The cap also prevents a user from overtaking medication. They only open when that medication is ready to take. Organizing your medications and medication storage. I already talked about listing all of your medicines. Include supplements. You know, people just think of medicines like it's a prescription that I get from my doctor, but you list all medicines. Include supplements, include over-the-counter pills. Save all current packing instructions so you can refer to these if there's a problem. And I already mentioned that to you. When you get your new pill and you have all of this stuff that you're reading and it seems confusing, but you read it because you knew you had to find out what the side effects were, etc. But save that sheet of paper with your other forms of anything else, your medical situations or history. Save that piece of paper because if you've forgotten something, or you really want to go back to that and say, like, why do I have like a funny feeling in my throat every time I take this one pill? You'll be able to go back and see what the problem may be. Periodically, medication review with your provider, which we will talk about. I love this one. It's called a brown bag cleanup. Now, if you can do this yourself, you don't have to do it with anyone around, but if you want to do it with a couple of friends, it's kind of fun because you put every medicine that you have in your house. Every 6 months, you put a medicine, all of the medicines. Remember, you could go in your bathroom, your kitchen, your bedroom, wherever you keep medicine, and it doesn't matter if it's over the counter or if it's a prescription. Empty all containers of medications, prescribed and over the counter, in a paper or plastic bag. Make sure you search all places you keep your drugs: bedroom, bathroom, kitchen. Place all medications in a bag, then empty the bag on table and sort. Separate all prescription drugs from over-the-counter drugs. Review each prescribed medication for current use, expiration date, and any renewal needed. So you have your bag, and first time you do it, you're going to be shocked about how many different bottles you have, and some of them you haven't taken for like a year. So this is the purpose of it. Separate all of these drugs, review each drug, and make sure there are no expiration date and renewal if needed. So this is a way of cleaning up the medicines that you have. It's because you want to make sure that what you're taking is current. Look at that expiration date. Maybe you didn't realize that it was going to be due to expire within a month. So that's a clue. You have to make sure your doctor is going to renew that prescription. So this is just a way of making sure your medications are current, your medications are safe, and you do the 6 months or annually. Some people do it every 6 months if they have a lot of medications. And you'll be very surprised at the medications in this pile of medications that you think, well, I don't take this anymore. I don't need it anymore. Why do I still have it? And believe me, you don't want to keep it if it's expired. Medication no longer required. Medicines that are no longer prescribed nor needed should be discarded. And we will talk about that. There is a National Take Back Day. October 2020, it's done annually. And this is the 19th year that this National Take Back Day has commenced. It is on that day, total law enforcement, 4,153 law enforcement people. They could be police, even firemen. They're looking at how to make sure that medications are, if they're no longer needed, or they are expired. It is a great day. Now we don't have it for 2021. It has been always in the fall. So look forward to that day. Total collection sites. There are more than 5,000 sites in our state, and the total weight collected, 4,972 tons. Does that sound like a lot? It certainly is a lot, but this was done because they realized that there are so many medications out there that people aren't using. And what do? Well, they keep them, they give them to friends, or they throw them out in the trash, and that certainly is not acceptable. So there is this National Take Back Day. Look for it in October 2021. It's always the same time of the year. You can also go to your pharmacy, but we will talk about that. But if you just want to be part or participate in the National Take Back Day, it's really a good thing, and it's sort of rewarding because you say, I make sure I cleaned out my medicine cabinet, and I also am taking it back to the right place. So, how do you take back safely dispose of unused or unwanted medications? When picking up a medication or by mail, always ask for a drug disposal pack. So your pharmacy or by mail pharmacy can provide to you what is called a drug disposal pack. Now, if you think that you're just going to use, this is a one-time medication, it's an antibiotic, I'm not going to need a drug disposal pack for it, you don't have to do that. But if it's something that you're taking, let's say for 3 months and you only use 1 month of it, that's when you would want this drug disposal pack. All prescribed medications being disposed should be contained in their original bottle, but with your personal information removed. That is so key. So you keep it in that original bottle, you take off the your personal information and then put it, we'll talk about it, in a plastic bag. Approved medications to be disposed of are any over-the-counter that is expired, prescription medications, your patches, your ointments, vitamins, anything that you took. Don't just throw them away. There is something that you can do for take back, and they will take back any medication. The take back program, there's a kiosk site. It's approved by law enforcement. Or you Google take back program, it will tell you where these sites are. Google Maps is another source, and all you say is go to Google Maps, drug disposal near me, and that's going to come up. And again, as I said in the very beginning, it is our responsibility when we are taking medication. You're not asking anybody to help you. You know it's your medication, it's in your apartment, your house. You should get rid of these medications. Disposal of unwanted or expired medications. Do not flush down the commode. The Environmental Protection Agency is in opposition of this. It used to be one of the things, people, well, they stopped taking the medication, they wanted to get rid of it. Well, what did they do? They put it in the commode and flush it. You crush solid or liquid medication and mix with kitty litter, sand, or dirt, or anything else that will absorb the medication. So you already crushed the solid. The liquid you just pour in a plastic sealed bag and place it in your trash. Or you go to a take back program. So this is a way of doing it yourself, and crush any solid or liquid RX, mix with kitty litter, sand, or dirt, anything that will absorb, and then put it in a sealed bag. Then that can go in your trash, and that is okay. Safe disposal of used needles. Now, there are people that will be taking their glucose finger stick, should go into a safe disposal. If you're taking any medication by injection, go into a disposal. So safe disposal of used needles. Immediately place used needles in a sharps container. Or if you don't have a sharps container, and I'll talk about that, you use a heavy-duty plastic container made of heavy-duty plastic, puncture-proof lid, upright, leak-resistant. So any of these needles that you have, you don't just toss them in the trash, because number one, somebody can prick their finger with it and they will get an infection for sure. So you absolutely have to use something that is appropriate. You dispose of used sharp containers according to community guidelines. Contact local public health department for more information. So when you're first diagnosed, let's say with diabetes, and that is something that people know that they have to give an injection minimally once a day, they're the people that should really be alert to this, because a sharps container is something that's very good. All of the hospitals use them, but you can buy them at your pharmacy. Wherever you get your medication for your insulin, they know that you're going to be injecting yourself if it's type 1 diabetes, and you're going to ask them, do you have a sharps container that I can purchase? And they do. So your pharmacy is a very easy place to get the sharps container. I'm going back to that. So contact your local public health department for more information. It sounds like a lot to do, and it is, but the reason we're discussing it, there are so many issues out there in our society today. The drug addiction, look how many children, 2,500 children are using drugs for the first time in their life in the United States, 2,500 people. Well, how do they get these drugs? They get them because they're left around, they're expired, they just see them in the cabinet, and they're going to say, well, I see my mom take this, I wonder what it's for. And they start this habit. So you have to protect everyone in your family. And this is, what I'm saying is the best thing that you can possibly do. So before I end, I am going to say again, keep a list of your current medications in your wallet or purse and update it as needed. So remember, if nothing else, remember to get that list ready, put it in your purse or your wallet, and when you need it, it's right there. Even when you go to the doctors, you go to the doctors and they're going to ask you, are you taking your medicine? What's the list? What medications are you taking? You have it right there. You don't have to fumble and worry about, did I tell them everything? So make sure you do that. And I am going to say, are there any questions?
You can unmute yourself. Yep, if you have questions, go ahead.
No, I don't have any questions. You just reinforced basically everything that I already do.
Well, that is wonderful. I should have had you, if you probably know more than I do. That's huge.
Yeah, but the only thing I wanted to mention was, I know you were talking about opioids, and for like the past 30 years or so, I have had fibromyalgia and other ailments, and I've been on opioids, and it was a concern of mine about getting addicted to them. But my physicians explained to me that I couldn't get addicted to it because my body sensed that I was in pain. And when I took the medication, it was helping. But the only problem I had is that I didn't always want to take it consistently because I was scared of getting addicted. But they said that I was doing myself more harm by just taking it when the pain came, because it would take longer for it to work than if I took it as it was scheduled for me.
Well, that is correct. Because if you wait too long, that pain medication is going to take longer to even help you or alleviate that pain. So that is a very correct statement to make. The only other thing I would suggest, have you talked about different medications? Because you said that you've been on it for so many years. Look how many years that we have explored different medications that you might be able to use instead of an opioid.
Well, I've actually been able to wean myself off of them, so I'm no longer on them, thank God. But I mean, I was at one point on Vicodin and
Percocet?
Morphine at the same time,
wow.
because I got hit by a truck, and that pain was just so unbearable. And I had a stimulator, and it took my stimulator out of whack, so that wasn't even controlling the pain anymore.
Wow.
Yeah.
Well, no, I'm glad that you said that, because I thought that you had mentioned how long you were on it, but it wasn't that. You were just saying that how many years ago you had it. And yes, absolutely. When you have pain, you need to get the best medication you can to alleviate that pain, because you heal faster when you're not in pain.
Yeah.
So, well, that's a good comment. Thank you.
No problem. But thank you. You just reinforced everything I was doing, and it was helpful. Just to know I was on the right track.
That is so wonderful. Thank you. Well, because of the snow, Maria will put it online as she always does. So I hope more people will be able to take advantage of the program. But I will say that March 18th at 11 a.m., I'm going to be back. Presbyterian, wouldn't I love to be back in person, but I'll be doing another Zoom, and it's called Healthcare Choices. So I think that it's very interesting, because a lot of people, when you think of healthcare, your head goes right to that nursing home. Oh, I'm not going there, not me. I'm too good for a nursing home. So therefore, I'm saying things have changed over the years, but still we have many choices that we can take advantage of, especially living in the state of Pennsylvania. We have so many seniors that live here that sometimes are, looking for healthcare or just a different living experience to be able to manage, or to be able to go to a continuing care retirement community and meet new friends and know that you're cared for essentially for life. So it's going to be a very interesting program. Hope to see all of your group on and have a wonderful snow day. Thank you all very much.
You too. Thanks
Okay.
a bunch.
Thank you. Bye.
Bye.